Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is Health Disparities, Promoting Equity and Diversity in Clinical Research, and is presented by Nancy Wintering. This webinar will be recorded, and the recording will be available on the CITI program's website. Now, let me tell you about today's presenter, Nancy Wintering. Nancy is a licensed clinical social worker. Her master's degree is in social work from the University of Pennsylvania. Nancy maintains an ongoing commitment to building strong and diverse research teams to promote inclusive practices in research. She's a dedicated mentor. Nancy is active in the development of research-related training and education through CITI program, the Society of Clinical Research Associates, publications, conferences, and workshops.
So first of all, let's talk about the objectives and the learning objectives in this webinar. We'll identify health disparities and their impact upon affected individuals. We'll discuss how disparities are expressed in healthcare and in clinical research. We'll review the National Institute of Health and National Institute of Minority Health and Health Disparities resources and initiatives, and utilize strategies and tools to facilitate more diverse and inclusive research practices. So the scope of this webinar is really a broad overview of health disparities in the U.S. Certainly, this is a complex and compelling topic. This talk will provide an introduction to key concepts, resources, and strategies to address health disparities in clinical research. And these are the key areas in which we will discuss today: health disparities overview. We'll look more at the NIH and NIMHD initiatives to support and transform research. And finally, some very concrete strategies and tools to promote inclusive research in your practice. All right, so the first topic is health disparities overview. So let us begin, first of all, by defining health disparities. Health disparities are a particular type of health difference that's closely linked with social, economic, and/or environmental disadvantage. Health disparities adversely affect groups of people who have systematically experienced greater obstacles to health based on their racial or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, or physical disability, sexual orientation, or gender identity, geographic location, or other characteristics. So the Institute of Medicine emphasized the importance of healthcare disparities in their report, Unequal Treatment Confronting Racial and Ethnic Disparities in Healthcare. And these are the groups of individuals who are identified as primarily being affected. Now, that doesn't say necessarily that men, because men aren't specifically identified in this group, that men can't experience health disparities, but these were the primary and key areas in which persons with health disparities were affected. So I'd like to go through a few key terms because these are really important terms to sort of differentiate when we're discussing health disparities, so that there's an understanding that there are subtle distinctions when we're approaching this topic. So a health disparity population has really a significant disparity in the overall rate of disease, the incidence, prevalence, morbidity, mortality, or survival rates in the population as compared to the health status of the general population. So by prevalence, I mean the rate of disease that occurs in a particular population at a specific time. Morbidity refers to the physical or psychological state when compared to healthy well-being. Morbidity can also be used to describe a decline in health associated with chronic illness. Mortality refers to the risk of death. Comorbidity refers, of course, to multiple disorders, diseases, or conditions that can occur concurrently. However, the conditions may not necessarily be related to one another. And of course, survival is the likelihood of survival after the time of diagnosis. And within cancer research, for example, the survival rate is often set. So let's shift now to some of the ways in which disparities are expressed. This may be done by implicit bias towards individuals or stereotyping of groups. So with implicit bias, individuals are automatically categorized based on previous experience or stereotypes of certain ethnic groups. Implicit bias can emerge over time without one being aware of negative feelings towards an individual or a group. Of course, in stereotyping, there may be a tendency to stereotype persons with similar characteristics with one another, or assumptions that are made on race or other factors like which ethnic group is good at playing basketball, or who's better at math, or perhaps there may be other negative connotations, like, for example, assuming that persons of certain groups have a limited capacity to perform activities. So in stereotyping, we do not treat the person as an individual as themselves, but they're filtered through a lens of seeing them as a member of a group. And then again, individuals are categorized based on racial, ethnic, or social characteristics or expectations that those characteristics occur. So how can addressing health disparities affect research? Well, one of the things, again, Burchard, remember, talked about the deficits. Well, Burchard also proposed some potential actions that could be taken. One of the things that could be done is really to create incentives to conduct minority research, to make sure that the resources are there and the adequate support is there. And then also ensure that there's fair review of grant applications that focus on minorities. Dr. Valentine and Dr. Francis Collins have published and have undertaken some initiatives to really make certain that there are more inclusive processes that would enable and support So getting to the end here, think about perhaps, again, thinking back to the feasibility plan, develop corrective action plans to set specific goals to address inclusion and diversity issues, not only in staff development, but in recruiting and enrollment practices. Whenever possible, I really encourage you to take a patient-centered approach that's culturally competent. And again, with regard to the area of debriefing, if you don't feel comfortable in a particular area, maybe have a discussion. Don't look at it as an old personal deficit, but this is something that's a quality issue that can really improve the whole team. Again, so health disparities do exist and impact many groups and individuals, but by promoting diversity in research, this can really help to reduce health disparities. Each of us can play our own part in doing this, and even by having a dialogue in this regard, this helps to overcome some of the barriers and obstacles. So I encourage you to really utilize the resources. Researchers, sponsors, IRBs can all play a key role and a key part in promoting diversity.
We encourage you all to monitor the CITI program website for additional information about future webinars, available on-demand recordings of past webinars, and our new all-access webinar package.